Hello folks, I want to do a quick video for you on the muscles of the leg, or the muscles that act on the upper leg, so the thigh. Um, Remember that this is a ball and socket joint, the joint that the femur makes with the pelvic girdle. And so it's capable of all those motions that the shoulder is capable of. So we're going to be looking at muscles that do basically three complementary movements, and we're going to look at the front of the bit, or the back of the leg first, and then the front of the leg. So the movements we're thinking about are flexion and extension. So if you remember, this would be flexion, right, of the thigh, right, flexion at the hip, right, that's flexion, and then extension would be extending this angle here. So that would be extension, right? So we'll look at flexion and extensors. We're also going to look at muscles that abduct the thigh, right? So those are abductors that take it away from the midline. And then those that take it in, those are adductors, right? And then we have rotators, right? So we can either flip the leg out, right? That's lateral rotation, or we can rotate it inward towards the midline. That's medial rotation. So I'm wearing black pants, so it's maybe hard to see, but this would be lateral rotation out that way. Medial rotation be in that direction. Okay, so those are the movements we're going to be looking at. Those are the actions of the muscles that we'll be looking at. Okay, so we have our zygote body here. We're going to take a look first at the back, and so we'll see muscles that are extending the hip, or are rotating the hip, mostly laterally rotating, or are abducting the hip. So this first, we'll look at this big one. We'll go superficial to deep, right? So we'll be pulling muscles off as we go. This is the gluteus maximus, a very large muscle here on the back of the leg. You can see that it's originating here, and we'll take a closer look at this on Get Body Smart, on the sacrum, and even a bit on the ilium, the posterior portion of the iliac crest. And then it's inserting on the back of the femur, along the linea aspera of the femur. So that's our gluteus maximus, an important extender of the hip. Then we've got up here our gluteus medius. Notice it's more anterior, and it's along this whole blade of the ilium. And so it's more anterior located. And this is a really flexible muscle because it is this convergent muscle. We talked about how those are flexible in what they can do and the movements they can produce. We can see we'll get different movements if we contract anterior fibers versus if we contract posterior fibers. And so this, again, originating here on the ilium and inserting on the femur. And this is around the greater trochanter of the femur, but it's on the lateral aspect of the femur. Now we got to get rid of these so we can see what's underneath. We'll get rid of the maximus, we'll get rid of the medius, and we'll see the gluteus minimus here. This now is even more anteriorly located. It's basically underneath the gluteus medius that was just up here, and you can see it inserting very much on the anterior portion of the greater trochanter of the femur. Okay, so there's our gluteus minimus, and then we've got, let me take this off. Okay, that's not helping a terribly lot. We do need to look at the piriformis, right? So the piriformis also originating here now on the anterior surface of the sacrum and inserting on the greater trochanter, and we're seeing it here on the back, the posterior surface of the greater trochanter. Okay, so all of those gluteal muscles, the maximus is an important extender, but those other gluteal muscles are much more involved in abduction. And depending on their insertion points, whether they're on the front of the trochanter or the back of the trochanter, involved in lateral or medial rotation, or in the case of the medius, with those anterior and posterior fibers capable of both, depending on which fibers are firing, both lateral and medial rotation. Okay. So we'll pop over here to Get Body Smart and take a closer look at these, peel the muscle layers away and see that their origin and insertion points and a demonstration of their actions. Okay, so here's our gluteus maximus. We're pulling away all those other muscles, although it is superficial, so we don't need to go far. You can see the origin here on the ilium and on the posterior portion of the ilium and then on the sacrum. And this is all originating on the posterior of these bones and then inserting on the linea aspera and gluteal tuberosity of the femur, right? So we can see that here. Let's take a look at the actions, right? I said it's a pretty big extender of the hip, so that's extension, right? Pulling it back, although I was showing extension going even further back, so it's even involved in hyperextension of the hip. And then this is also a lateral rotator, right? A bit of lateral rotation. That makes sense given its insertion here. It's not a huge strong rotator, but it's pulling on the outer, or the insertion is on this linea aspera, which is closer to the lateral border of the diaphysis. So when you shorten this muscle, it will produce a bit of lateral rotation, and then even a bit of, although it's mostly an extender, you can get a bit of uh, of, of abduction as well. So here's a little abduction of the thigh at the hip. Okay. So that's the gluteus maximus. Now we'll do the gluteus medius, right? So remember, a little bit under and very much anterior. So this is this outer surface of the ilium, and then inserting on the lateral and superior portion of the greater trochanter. So there we are. There's our origin, right? And then insertion on this lateral and superior portion of the greater trochanter. So again, you can tell you shorten these fibers, you're definitely going to be abducting this femur. You're going to be pulling it out. And there'll be a little bit of rotation as well. But given this very rather posterior fibers and rather anterior fibers up here, we're going to be able to get both. So, yep, big abductor for sure. But then anterior fibers are doing the medial rotation and posterior fibers are doing lateral rotation. Okay, how about the gluteus minimus? Now this one is underneath everything, right? You can't even see it from the outside, or from looking at superficially, you can't see this muscle at all because it's entirely underneath the medius. But really a similar origin point just further down, right? So also on the outer surface of the ilium, and then this one is definitely on the anterior. And we saw that in the zygote body, it was wrapping around to the anterior portion of the greater trochanter, or the femur. Sorry. So here we go. Pull everything away. And there you can't even see the insertion point because it's on the front of this, right? And this is showing the posterior portion of the femur. So origin on the ilium and insertion on the greater trochanter. And so you can see, you pull on this, it's going to be another major abductor of the femur, but it's also going to be a rotator of the femur because of its insertion on the anterior portion. So we get definitely some abduction, and then at least the anterior fibers are important for medially rotating the femur, right? And that's because of this insertion on the anterior portion of the greater trochanter. Okay, and then finally our piriformis muscle. This is a deep muscle as well, so we have to pull off a lot of stuff to get to it, right? And there you can see this origin really on the lateral border of the sacrum, and then on this really inferior portion of the ilium. So the anterior surface of the lateral sacrum, and then the insertion on the greater trochanter of the femur on its sort of superior and medial surface. So really on the inside of this, right? There's our origin on this anterior surface, and then insertion here. So really similar insertion point, just a little more medial than the gluteus minimus, right? So again, this one is definitely an abductor, but it's also, you can guess, a rotator, right? And this is going to be a lateral rotator basically because it's hard to see this in 3 dimension, right? But because this this is sort of more forward than the insertion point, then when it pulls on it, it's going to rotate the femur outward, right? So it's a little a lateral rotator, but primarily an abductor. And this really occurs mostly when the thigh is when we're thigh is flexed at the hip. So when you're flexing the hip, it serves as an important abductor. Okay, let's take a look at some of the other muscles that are now on the front of the femur and working on the anterior portion of the femur to do something to the hip. Okay, now we've flipped us around and we're looking at the anterior portion of the leg. And we're going to look at a muscle that kind of is in between these ones that we just saw, which were mostly abducting and flexing, and these ones we're going to go to, which were mostly abducting or sorry, that were mostly abducting and extending. And then this one, which is mostly uh, uh, these next group, which are mostly adductors and flexors. So this is the tensor fascia lata right here. Right, you can see this is a more anterior than all those gluteal muscles, and it has it inserts on this broad band here called the iliotibial tract, right, which is a big tendinous sheath, and it actually inserts not on the femur but way down here on the tibia, right. Now, this is a little bit of a different one in the sense that you can see by its position laterally here that's probably going to be abducting the thigh, and it definitely does. But because of this more anterior position, and because of, more importantly perhaps, because of its insertion on the anterior portion right here, anterior portion of the tibia, it's also going to be an important flexor of the thigh. Okay, so that's the tensor fascia lata. And maybe let's pull this off so we can start to see some of these others, right? We've got a really important hip flexors. Let's do those hip flexors, and this is the major function of those. I'm going to have to pull off these obliques and get deep into here because we have to get all these abdominal muscles, even the rectus abdominis has to go so we can see the insertion of some of these. I'm going to get rid of this as well. We're not going to worry about the psoas minor, but these two, right? There's the iliacus and the psoas major. Those are called your hip flexors. And these are deep muscles, right? You can see first that the origin of these is on the thoracic vertebrae, right? And the insertion is on the anterior portion of the femur. And it's pretty difficult to see exactly where, but I'll show you that in Get Body Smart, right? So anterior surface of the femur, origin back here, right? This is a back here on the vertebrae. So this is a major flexor. When you contract this, it's going to pull the hip up, right? Same with the iliacus. Now the origin is here on the iliac fossa, but it's the same insertion point as on this anterior portion of the femur. I wonder if I can get on this anterior portion of the femur. Sorry. Let me, where's my iliacus? I have to flip around. There we are. There's my iliacus again, right? Major hip flexors. Then we've got other muscles that are doing a bit of flexion, but mostly doing adduction, right? So we have let me get rid of our sartorius here. And we're going to go deep into the leg to do this. Okay. So all these muscles in here, right, this is what we're going to be concerned with. Here we have, we're going to get rid of our pectineus. Here we have our adductor longus and then our adductor magnus right back there. So here's our adductor longus. You can see this adductor longus is having its origin here on the anterior portion of the pubis, right? So there's our adductor longus and it's inserting on the femur, right? And yeah, these are inserting on the posterior portion of the femur, right? So there's our adductor longus, right? And here's our adductor magnus, a really broad insertion, linea aspera of the femur, uh, among other spots. Right? Sorry. Here's our adductor magnus, right? Really broad insertion, also inserting on the tibia, right? So this is another major adductor, but also a bit of a flexor. And then we've got our really internal here, our gracilis, right? Again, origin here on the pubis and inserting on the medial portion of the tibia. So this is another important adductor. And then, this one is that we have this, and I already pulled it off. Whoops, sorry. We've got our sartorius. Just going to stay right here. Here's our sartorius, right, with this origin way up here on the iliac crest, and then wrapping all the way around the leg and inserting on the medial tibia. Oop, sorry, I froze there for a minute. And this is another important, although it is a flexor both of the hip, but also of this lower leg. So there's our sartorius, right? So a flexor of the hip and the lower leg. And we get it all. Yes. So I think that takes care of the hip. Let's go and take a look at each one of these in Get Body Smart. So here's our tensor fascia lata, and we can see that the origin here is on the iliac crest, or the outer or lateral portion of the iliac crest. Yep. And an anterior portion of the iliac crest, and then insertion on the lateral condyle of the tibia, but that's via this iliotibial tract. So if we pull all that, so this is this long iliotibial tract, and here's this anterior lateral portion of the tibia. So a major adductor, right? Sorry, abductor, abductor of the thigh at the hip. I think I might have switched those. Abductor means abduct is to take away. So we're moving it away from the medial. And then, as I mentioned, it's a bit of a flexor as well, although a fairly weak flexor, but it does flex the thigh at the hip. So this kind of, now we're having a different, different motion, right? We were looking at extension and all those last group of muscles. Now we're looking at flexion, but having a similar abducting effect as some of those last muscles we looked at. Now let's go to the like pure flexor, right? The psoas major and the iliacus, right? So here's our, pull this all away, get rid of all this stuff. There's our psoas major, right? These lumbar, oh, did I say thoracic vertebrae? Sorry, I think I did before. These are on the, originating on the lumbar vertebrae, inserting on the lesser tubercle, lesser trochanter of the femur, right? So there's L1 to L5, and then insertion on the lesser trochanter of the femur. There we go, right? And there's our insertion point. So an important flexor of the hip, and that's the primary job of this one, right? Major hip flexor. It does a little bit of lateral rotation. You can probably tell based on this insertion being more posterior than this origin. If you pull on it, it's going to just sort of rotate the hip outward a little bit, right? So a little bit of a lateral rotator. Yeah, and those are the primary actions of it. It can flex the vertebral column just the same way as sort of the rectus abdominis can flex the vertebral column, and it does a little bit of that in conjunction with the rectus abdominis. Okay, the iliacus, another hip flexor, and really having the same insertion point, right, as the psoas, and origin on this iliac fossa. So the lesser trochanter again is its insertion point. You can see that there, right? Insertion on the lesser trochanter. So similar motion, although now this origin is more anterior than this, so it's not going to be as critical of a as important of a lateral rotator, but major flexor for sure, and a bit of a lateral rotator, and even less of a trunk flexor, um, but it can do that as well. So mostly, primarily a major hip flexor, and then a lateral rotator of the thigh. Okay, now let's look at these adductors. The adductor, what do we have here? Longus first. So here's our adductor longus. Let's just skip all. Oh, there we go. So origin here on the pubis. So just below the pelvic brim here, right? The, the superior portion of the pubis. And then kind of the middle third of the linea aspera, right? So the middle of the linea aspera, you could say that's the insertion. So the origin there on the pubis, and then insertion here, we're flipping to the back on the linea aspera, right? Kind of this middle portion. It starts up here, right? There's the gluteal tuberosity, and then, yeah, and then you get further down here into the linea aspera that goes all the way down. So major adductor, right? You shorten this muscle, you're going to be pulling the femur in. So major adductor of the thigh at the hip, right? Pulling it in. And if depending on the portion that is contracted, right? And because again, you have an anterior origin and a posterior insertion. When you pull on this, you're going to get, in addition to adduction, a bit of flexion, right? So you can get a little bit of flexion here as well, right? And that's simply because it's crossing from anterior to posterior surface, right? It's origin anteriorly and the posterior insertion. Let's see. Now we've got our adductor magnus. Remember, this is that big, broad insertion, right? Magnus meaning large. So the origin is on the pubis and ischium, and there are a couple of different heads to it, right? Another origin on the ischial tuberosity. So this has a pretty broad origin and a pretty broad insertion as well, right? The insertion on the gluteal tuberosity, the linea aspera, even all the way up to the supracondylar line of the femur, and then also on the adductor tubercle of the femur. So let's just take a look at all of these insertion points, right? You can see insertion here, way up here, insertion along the linea aspera, and then insertion here on the condyle, right? Just above the condyle of the femur. So there's our origin. You can see you've got the anterior, or you see you got the pubis involved here, but then basically all of the ischium as well, right? The ramus of the ischium, all the way back to that the ischial tuberosity, right? All the way back here to the ischial tuberosity. Let's see the flip around here. So look at that, right? All of this, all along the linea aspera, right? There's the ischial tuberosity. There's the supracondylar and posterior supracondylar portion of the femur. So many, many origins and many insertion points. Right? And so again, and this one, because the origin isn't quite as far forward, it's not going to be as strong of a lateral rotator, but it will participate in lateral rotation and certainly in adduction. This is a really strong adductor, mainly because of its very large and broad insertion. So it's going to be pulling the femur in quite strongly. So here's our adduction at the hip. Oh, and I forgot to mention a little bit of flexion here too. Not as much flexion because it isn't originating as far anterior as we saw the adductor longus, but we'll also get some flexion at the hip, right? And depending on which fibers are stimulated, right? Like this is the furthest back origin point, and it is quite far back on the ischium. because it's completely on the backside, you even get a little bit of extension, although it's fairly weak because this is also posterior insertion, right? So you're going to get a little bit of extension, right? Okay, and then let's see, we've got finally the gracilis. Okay, so here's our gracilis. Now this is a similar origin to the magnus, but a smaller. So the inferior border of the pubic body near the symphysis. Not the longus, but the magnus, right? And then the insertion is this, again, on the tibia, right? And on the medial surface of the tibia. So as high up as you can get to, right? So the proximal medial surface of the tibia. So let's just see that origin down here, right? Kind of in between what we saw with the magnus, right? And the longus, which was originating up here. We've got the gracilis, right? And then there's our insertion point on the tibia. So that this is really just adducting. That's all that it's really doing. It's a really thin muscle, right? Narrow little parallel muscle. Small origin, small insertion. It's basically a straight line down. It's not really crossing much from front to back or anterior to posterior. So it's basically just doing adduction. All right. I think we got everything. And now we'll move on in the next video to flexors and extensors of the lower leg. So flexion and extension occurring at the knee. And that's really all we get here, because remember, this is a modified hinge joint. So we really only get, it's basically monaxial, right? Whereas this was a ball and socket joint, is a ball and socket joint. So that's why we could get things like adduction, abduction, rotation, lateral medial rotation, and flexion and extension. Okay, so I'll see you again for that video.